Hi, Andrea. Can you introduce yourself in few words?
My name is Andrea Carmine Belin, and I'm an associate professor in neuroscience at Karolinska Institutet in Stockholm, Sweden, where I have established the first research center on cluster headache.
Can you share with us some insights about the new medications for cluster headache and new research for cluster headache?
My main focus is the genetics of cluster headache. Between 2 and up to 20% of the cluster headache patients report that they have a close relative with cluster headache. So there is a genetic link, not as strong as in migraine, but still there is a link. So we have established a network, the International Consortium of Cluster Headache Genetics, where we have performed genome-wide association studies on cluster headache cohorts. And we have identified 8 different regions on the chromosomes that are linked to cluster headache. And now we want to dig in which genes are in these regions and how can they make sure that how can they be part of developing cluster headache.
Andrea, you feel that cluster headache is underdiagnosed, and sometimes there is some overlap between migraine and cluster headache, and sometimes there is some difficulties in differentiating between both, especially in less experienced settings. So how can you give guidance to junior neurologists to differentiate between cluster headache and migraine?
Well, there's definitely a problem when it comes to classifying or diagnosing cluster headache. A lot of people get the migraine diagnosis instead of the cluster headache diagnosis, especially women, since cluster headache is more common among men than women. But there are differences. The cluster headache attacks are shorter, between 15 minutes up to 3 hours, compared to migraine, which is more than 4 hours. And they're always one-sided, and they're accompanied with autonomic symptoms like tearing of the eye, a runny nose, restlessness. The cluster headache patients, they want to walk around, while migraine patients tend to lie still in a dark room.
Andrea, can you share with us some insights or some news about the new medications for treatment of cluster headache?
But one big problem with cluster headache is there is no treatment that has been developed specifically for cluster headache. You use treatments that are developed for migraine, like the triptans. But now we'll see if the new CGRP treatments, if they can be suitable for the cluster headache patients. We'll see what the future shows.
Andrea, you are specialized in cluster headache. What are the challenges you have in the field of cluster headache as regard the research and clinical practice?
The biggest limitations are, of course, the awareness on cluster headache. I think that's something we really need to work on. Both among general practitioners, but also among the society, that people tend not to know what it is.
We are now in the IHS 2025 in Sao Paulo, Brazil. Can you share with us some insights from the conference?
I think a very important session was yesterday when we got to know how headache care, the big limitations in certain countries in the world that look so different. It was a big insight for me.
Thank you, Andrea. Thank you for your time. We enjoyed being with you. Thank you so much.
Thank you.